to.
Sorry, go ahead.
All right, no worries. I'm really happy to have the opportunity to talk about this really important article with the GAINSWave provider group. We've all been using PRP to a greater or lesser extent for the past couple of years, but really the data for using PRP in sexual medicine wasn't there. And so a couple of months ago, I get a pre-release version of the Journal of Sexual Medicine, and I saw this article. I got super excited because this group in Greece is really one of the top sexual medicine researching groups in the world. They've put out some amazing articles on shockwave therapy, both for erectile dysfunction and for chronic pelvic pain. If you haven't seen their article on chronic pelvic pain, it's really extraordinarily well done. Their scientific methodology is exceptional. And so let's see. Okay, so this is the Journal of Sexual Medicine, and the article appeared May 1st, 2021. Platelet-rich plasma improves erectile function, a double-blind, randomized, placebo-controlled clinical trial. And this comes from the lab of Dimitrios Hartsikristou, who is based in Athens, Greece, and Ioannis Mikianidis is really the driving force right now behind that lab. And he and I have been in communication over this publication and a number of the other publications that they've created. They really do exceptional work. Because in sexual medicine, you have to really delve into who's actually doing the work, who's funding the work, and how the work is being done, because it's a sexual medicine, the outcomes are kind of a moving target, as opposed to, say, hair growth, where if you inject PRP, you can check a follicle count, you can check the size of the follicles, et cetera, et cetera. In sexual medicine, there's so many variables that go into erectile function, orgasmic function, and the completion of intercourse that it's really important to look at what the outcome measures are. So this, like I said, it was a double-blind placebo-controlled study. So they found 60 patients. In the end, each group had 20. They had 20 people in the placebo arm and 20 people in the treatment arm. And there were 2 injections of 10 cc's of PRP versus placebo. And it was blinded both for the patient and for the injector. And so that the syringes that they had were actually covered in like a tin foil, so that the doctor that was injecting either the PRP or the saline didn't know whether they were injecting the saline or the PRP. And I'm not exactly sure whether they chose only 2 injections. But the other thing is these patients didn't have any other treatment at the same time. So they weren't undergoing shockwave therapy. They were cleaned out of PD5 inhibitors or nitric oxide boosters or vacuum erection devices. You know, in research, if you're trying to isolate a factor, it's important to isolate it outside of any other variables. And they did the intracorporeal injections 1 month apart. And their technique is very similar to the technique that I use, as opposed to the classic Charles Reynolds P-shot. They did an injection of 5 cc's in each corpora. So the Charles Reynolds P-shot is 2 injections on either side of the corpora and then 1 in the head of the penis. I personally don't feel that's necessary. An injection in the right and the left corpora, slowly over a 2-minute period, was what they did. And they used a penile tourniquet for 20 minutes after the initial injection. Give me 1 second. I got something in my throat. Sorry about that. I need some old coffee. Okay, and they put a penile tourniquet on for 20 minutes after the injection to hold the platelets in. They didn't use platelet activation with calcium chloride. And then they used a the Magellan machine, which I believe is a double spin machine, which gives a very high concentration of platelets, and they drew 60 cc's. So if you have a single spin machine that you only draw 20 cc's, I don't think that the results that you're going to get are going to be equivalent to the results that they get in this study, because in my experience, a double spin machine is going to give you a significantly higher concentration of platelets, maybe 2 to 3 to 4 to even 5 times what a single spin machine does. And that's in my own personal experience. And a 60 cc blood draw, by definition, is going to give you 3 times of what a 20 cc blood draw is going to give you. And then they did assessment at baseline at 1, 3, and 6 months post-injection. They used the IIEF, so the International Index of Erectile Function, the SEP, which is the Sexual Encounter Profile, and the EDITS questionnaire to study this. Okay. Average age of their participants was 58, which is, pretty similar to most of our GAINSWave patients. They checked testosterone, so that's really important when you're treating men for erectile dysfunction, that their testosterone. So if their testosterone's 200-300, it may be time to replace that. And then their IIEF, which is the erectile function subscore of the International Index of Erectile Function, was an average of 20. So these guys weren't severely affected by erectile dysfunction. Okay, so this study uses what's called the MCID, the minimal clinical important difference. And so what that is if the IIEF increases by 2 or more in mild or mild to moderate erectile dysfunction. So for those guys who start with an IIEF of 20, getting them to go up by 5 is pretty unrealistic. So a clinically important difference might just be an increase of 2. But if your shim score or your IIEF is 10 or 12 or 15, then maybe a bump of 5 is going to be more clinically significant. So this table basically looks at the percentage of patients who attained an MCID in the IIEF. So when you're looking at the statistics at 1 month, for the PRP group, it's 76%, and for placebo, it's 25%. It's like, wow, that's a tremendous result. And to a certain extent it is, but really what you're looking at is an increase in the MCID, or an increase in the shim score of usually 2, in more severe cases 5. And so it is a remarkable result, but it may not be as dramatic as those numbers would indicate. So at 1 month, going from 25% for the placebo group to 76% in the injection group is remarkable. And then at 3 months, for some reason, the placebo group went up to 39%. The treatment group stayed at around 70%. And at 6 months, the treatment group remained at 70%, whereas the placebo group went back down to 27%. So, the really interesting thing is, one, there was a statistically significant group. I mean, if you look at the p-values, they're less than 0.001, but that the PRP maintained the clinically significant difference out at 6 months. And the interesting thing is, if you look at the recent Egyptian paper that came out on shockwave therapy, they had a treatment response of about 50% in their 300 plus men that they followed. But it seems like in that paper that the men that responded out to 30 months. And even in the Greek group, their study on chronic pelvic pain and using shockwave for chronic pelvic pain, the patients that did respond had a durable response. So it seems to me that if you look at shockwave therapy for erectile dysfunction, PRP for erectile dysfunction, or shockwave for chronic pelvic pain, the folks that respond are going to get a longer term response and the folks that don't respond are not going to get a long-term response. And so, really the key is to try to figure out who's going to be the responders and who are not going to be the responders. And so I'm working with a group up in Canada on a new ultrasound technology to basically be able to try to determine who is going to benefit from these regenerative treatment modalities. Okay, so this is the IIEF. So remember, the baseline was around 20. The placebo is the group in red. And so the placebo really, if you look at the standard deviation bars, the placebo group really didn't change. But the PRP group from baseline to 1 month jumped up fairly significantly from about 21 or so to 24. So the average increase in the IIEF score was 3. Now, if you compare that to GAINSWave, I wrote a paper or an abstract a couple of years ago looking at my first 40 patients, combining GAINSWave, 6 to 12 treatments, and the use of a firm nitric oxide booster. And I found an increase in shim score of 5. So it looks like the use of 2 injections of PRP will give you a boost of about 3.5 on the shim score, whereas GAINSWave plus a nitric oxide booster like a firm will give you a boost of 5 or 5.2 on average. And so it's just to kind of give you a scale of where this ranks. And then this is yes responses to the sexual encounter profile. So the SEP is basically guys keep a diary of their sexual encounters, and then you make judgments based on the sexual encounters. So it's just a different way of looking at erectile function. And there was a significant improvement in patients who underwent the PRP versus the placebo. And the key thing is, guys didn't know whether they got the PRP or the placebo, whereas with shockwave therapy, it's a lot more difficult to disguise the fact that you didn't give someone shockwave therapy. I mean, the device can make noise, but you're going to know if you feel the shockwave on your penis or not. Whereas with the PRP, it really is truly a placebo and double blind. Okay, so the findings of the study, I'm going to move this over here, is that intracavernosal injections of PRP are safe. So they didn't have any problems with it. And that's been my own personal experience. If you are very careful when you do these injections, and it's autologous PRP, it's safe, it's an effective treatment for managing non-severe erectile dysfunction. And in their results, 2 sessions of PRP led to a statistically significant improvement of erectile function compared to placebo. And this was maintained out at 6 months, which is really important. It's not a temporary boost that will go away. And then 2/3 of the participants in the active arm presented with a minimal clinically effective improvement. And so, that's really a remarkable outcome for using PRP, and there were no side effects from the PRP. And then they looked at satisfaction rates compared to placebo. So really across the board in this study, the use of PRP was beneficial and had long-term beneficial results, both in terms of shim score or IIEF, and then also in terms of a diary of sexual encounters, and then also in terms of how the patients perceived the benefits of the results. And so just to reiterate, this is the first prospective double-blind randomized placebo-controlled clinical trial evaluating the efficacy and safety of PRP for the treatment of erectile dysfunction. And the beneficial effect of PRP for erectile dysfunction was demonstrated based on common outcomes of the IIEF, the SEP, and the EDITS. And so where does this all fit in with what we do? Okay, so in a clinical study, you really have to isolate the benefits of whatever you're looking at. So if these patients were taking Viagra or Cialis and they were taking Affirm and they were receiving GAINSWave, you couldn't really isolate what the effect of just PRP was. And so in a clinical study like this, you're not necessarily doing the most you can for a patient. It's a clinical study to look at the beneficial effects of one single treatment. But really what we have now is another tool in the arsenal of technologies that we have to take really good care of our patients. And we have an indication of where that fits in terms of the overall benefit and the longevity of the benefit. So the overall benefit is to boost the shim score of about 3. And it's gonna, if it works, it's gonna last out to about 6 months. And so, you know, when I see a patient that's coming in, I take a global perspective to the patient. The first thing I do is take a history. I check their labs. I make sure their testosterone's okay. I make sure their thyroid function's okay. I make sure their kidney function, the liver function's okay. And then I have a body composition analysis scale. So we'll go over physical fitness with the patient. I talk about muscle building. I talk about fat elimination. I talk about nutrition. I talk about proper hydration. And then we get into talking about relationships. You know, who are they trying to have sex with? Are they monogamous? Are they polygamous? Are they gay? Are they straight? You know, what are the quality of the relationships at this point? And then really we go into erectile function. And I make sure, you know, pretty much everyone can benefit from a nitric oxide booster. It has improvements in, I just wrote an article for Adrian on the physical benefits of a nitric oxide booster like Affirm. It improves cycling times by 1.5%. It improves athletic performance in soccer players by about 4%. It improves bench press in lifters by about 13 pounds. Just taking a nitric oxide booster because it improves circulation. And then taking a PDE5 inhibitor, especially, I'm a big fan of having my patients take tadalafil, 5 milligrams in the evening. And then obviously I'm a huge fan of GAINSWave and working that in not just as an initial treatment, but then also as a maintenance treatment, either 6 to 12 months out from initial treatment, depending on what their underlying health conditions are. And then also if they're not getting nighttime erections, using a vacuum erection device or a penis pump for penile stretching every day, 10 to 20 minutes. And then finally, we have this absolutely fantastic option of a platelet-rich plasma, which is totally safe. It's autologous and can easily be done in the office. And so just to go over those things. So in the literature, a nitric oxide booster alone will boost shim score about 2 points. A PDE5 inhibitor like Viagra alone will boost shim score about anywhere from 5 to 8 points, depending on the study. GAINSWave will boost the shim score about 4 points in the absence of a nitric oxide booster. And then vacuum erection device, there really haven't been a lot of good studies to tell us exactly what it does in those respects. But PRP will boost the shim score about 3 points. Now, combining all those things together, I don't know what the total boost in shim score is going to be, but and it's certainly not going to be additive, but you can certainly expect a boost of at least 5, maybe as much as 10 or more, combining all of those treatment modalities into a single patient. Okay, so anyway, thank you for humoring me, for allowing me to discuss this really, I think, landmark paper in the treatment in sexual medicine. And I just recently finished putting out a patient-oriented sexual medicine curriculum on YouTube. And so if you text BMD to my office number, which is 925-255-7867, we'll send you a link to that to that YouTube site. So thank you very much for your attention, and I'd be happy to answer any questions that anyone might have or engage in a discussion.
Awesome. Thank you so much. I think that this is just a huge deal, obviously. So I'd love to have ongoing conversations about this. Again, as a reminder, if you're watching this throughout the weekend or after the live session concludes, feel free to post in the comment section and we'll continue the discussion there. But for right now, just some quick questions for you. Can you outline your protocol for PRP, GAINSWave, and nitric oxide booster for a non-severe patient versus a severe patient?
Sure, as soon as I figure out how to use my Zoom. Anyway, I'll look at you in a small screen.
If you want, you could just say, stop sharing your screen.
Oh, yeah. That would mean I could find it.
Do you want me to try to do it for you?
Oh, there you go. Oh, there we go. Okay.
Cool.
Pause share. Stop share. Oh, there you go. Excellent. Okay. I'm sorry. Can you repeat the question, please?
No worries. Sure. It says, can you outline your protocol for PRP, GAINSWave, and nitric oxide booster for a non-severe patient versus a severe patient?
Sure. So when my patients come in, pretty much everyone gets a nitric oxide booster like Affirm because we all need it after the age of about 40 or 50. A lot of my patients who are a little bit more severe will get tadalafil, 5 milligrams in the evening. The non-severe patients will get 6 to 8 treatments of GAINSWave. The more severe patients will typically get 12 GAINSWave treatments. The less severe patients will not get a penile stretching protocol. The more severe patients will certainly get a penile stretching protocol, which is 10 to 20 minutes a day of penile stretching. And then the less severe patients, sometimes I don't even do PRP, although now after this paper, I am recommending PRP at the end of treatment. One single injection of PRP with my more severe patients, I'll typically treat them on the 6th and the 12th treatment.
Perfect. Thank you. I know that'll be super helpful. Somebody says, I have a patient who says he was promised to increase penis size with a P shot. I'm not sure if I promised that, but perhaps our sales staff did. I tell patients that they can appear bigger due to increased blood flow, but I don't guarantee enlargement. Have you had any experiences with patients gaining size due to PRP?
Sure. So that's a great question. I'm actually engaged in the middle of what's called the P-long study. So I see a lot of men who come in after other penile elongation techniques, whether it's the E-list implant, where I've seen 3 patients who've had them removed. And once you have it removed, you get this massive amount of scar tissue at the suspensory ligament, so your penis is less functional and shorter. I've seen patients after fat placement, after injection of fillers, after suspensory ligament ligation. So I've seen a lot of disasters. And so it occurred to me that there had to be sort of a better way. And so I launched the P-long study, which is an IRB approved clinical research study, which is listed on clinicaltrials.gov. And we do a double spin PRP injection with a 60 cc blood draw, so almost exactly the same protocol as the Greek group is using. Once a month for 6 months, I also use a penile traction device and a penile suction device and Affirm to boost circulation. And we're following these patients out to 7 months. And without giving away too much, over a period of 6 months, we've seen growth in both length and girth. But just a couple of P shots, I don't think is going to give you a growth of length and girth. I think you have to be on a protocol where you're stretching length, you're stretching girth at least an hour, hour and a half a day, and taking a nitric oxide boosting supplement.
Got it.
So that's a really long answer to a short question, which is, does PRP improve length? The short answer to that question is no. The longer answer is there may be a protocol that I'm testing that will potentially result in improvement in length and girth.
Are
But
you
there may be an illusion of improvement of length and girth for, say, a guy who's in his 50s or 60s that's not getting full erections. Now all of a sudden he's getting full erections, and it seems like it's bigger, but it's probably not any bigger than it was when it was 20 years old.
right? Are you looking for any participants in that study, or have you reached?
Yeah, absolutely.
Okay, cool.
We're about a third of the way through recruiting.
Okay, great.
So anyone out in that's willing to come out to the San Francisco Bay Area once a month for 6 or 7 months, or anyone who's listening in the Bay Area,
yeah.
we'd be happy to have participants. Just go to my website, which is BrandeisMD.com, BrandeisMD.com, and then go to the clinical research tab and drop down, and you can sign up or get more information on the P-Long study.
Perfect. So when doing the GAINSWave treatment along with PRP, do you do the whole 14,000 waves or just 2,000 waves? Doing GAINSWave with the P shot is new to me.
Yeah, so what we do is we have the patient come in, we draw the blood, then we do a full GAINSWave treatment. And then after the GAINSWave treatment, we do the injection. And if you use a little bit of numbing medication during the GAINSWave treatment, the patients hardly feel the PRP. We use a 30 gauge needle, and it's a no-brainer.
Then this person says that they have a PRP machine that leaves it looking bloody then versus clear. Is that an issue for you ever?
I have a Purespin PRP machine, and it's when you use a double spin machine, you're eliminating the red blood cells in the very beginning, and then you're spinning the plasma with the white cells and the platelets, and so I almost never get I never get any staining with the red blood cells. Now, staining with a little bit of red blood cells is not a big deal. A drop of red blood cell is going to stain anything red. It's like making Easter eggs. A drop or two of food coloring is going to make the whole pot of water blue or green or pink. But whoever is asking the question is probably using a single spin system, and I used to have a single spin system. Now I use a double spin.
Okay, thank you. And then just to clarify, you don't find it necessary to use a dorsal nerve block. You find that the BLT cream is sufficient for numbing?
Yeah, I have a technique that I'll be sort of coming out with a teaching video at some point along the line, using special localization techniques. And eventually I'll have a video I got a lot of things going on, but eventually I have a teaching video talking about how I do a P-shot and how it's super comfortable for patients.
Awesome. And then this is our final question before we wrap up for right now, but what is the recent Egyptian paper you referenced earlier with shockwave therapy, and where can I find it?
Just look it up. It's actually it came out maybe 3-4 months ago, and it's now the largest study of shockwave therapy ever done. I think there were 340 patients.
Oh, wow.
And off the top of my head, I can't remember who the author was.
I'll try to look for it and find it, and I can post it within the group.
Maybe when things lighten up on my schedule a little bit, we can do a journal club on that one.
Cool.
Because that's really that paper and this paper are really two of the most important papers in regenerative medicine, in sexual medicine.
Yeah, this is a very big deal. So we're so honored to have you talk through it and kind of spearhead this entire initiative. So we appreciate you, and thank you so much, Dr. Brandeis. Have a great day, everyone.
Oh,
Right.
did I have one last slide? I think. Give me 1 sec. Am I on screen share now?
No.
Oh, I think I showed this one. If you're interested in my patient education videos for your patients, just text BMD to my office number, which is 925-255-7867.
Can you repeat that number, please?
925-255-7867.
Okay, and it is now in the comment section as well for anybody who's interested.
Awesome.
Okay.
Great.
Thank you so much,
All
Dr.
right. Thanks everyone for tuning in.
Bye.